Hi everyone, my name is Thomas. I'm going to present a new assisting technology for the diagnosis of minimally conscious state, which is a disorder of consciousness. So this is joint work between two research units from the University of Liège, namely the engineers from the InterSig laboratory and experts in disorders of consciousness from the Coma Science group. So disorders of consciousness are a very serious matter. For example, in the United States, over 3,000 people are affected by a severe disorder of consciousness each year. So such disorders these disorders are of several types. For example, so we have that a coma patient may evolve to unresponsive wakefulness syndrome, or a UWS, and then to minimally conscious state, MCS. In UWS, a patient shows no signs of consciousness at all and has a very limited and unpurposeful visual function. In minimally conscious state, there are signs of partial consciousness and the visual function is better. The distinction between UWS and MCS patients is very challenging sometimes, and yet it is crucial to make because it has major impact on resource allocation, on medical legal judgment, and on treatment decisions. As in some cases, some MCS patients might recover full consciousness provided that proper care is given. Visual pursuit is one of the first signs, actually visual pursuit is one of the first signs of consciousness. It is a very strong behavioral marker, and it has been shown that for assessing this eye tracking ability of a visual stimulus, the moving mirror, the handheld moving mirror, is the best stimulus. In clinical practice, the assessment of visual pursuit is done subjectively and can be sensitive and missed if the assessment is not done correctly. So experts from the field came to us engineers to ask us for an objective way to measure the visual pursuit ability. So we came up with a system, an assisting technology that is presented here. So in short, what we did is tracking the pupil and tracking the mirror held by the clinician, and then analyzing the trajectories of those objects and outputting a score of confidence for the presence of visual pursuit. The prototype we used in our system is as follows. It's a head-mounted device with two cameras, a high-speed camera for the eye, and a wide-angle camera for the scene where the mirror is to be presented by the clinician to the patient. So pupil tracking in our application is fairly simple because of the good quality of the images from the eye camera. Basically, it uses 2D template matching with a template update strategy. Mirror tracking, here we used a 3D shape registration technique which exploits two types of information: the texture information present in the frame of the mirror, and the epipolar geometry that can be estimated from the movement seen in the reflection of the mirror. So these two trajectories are then combined. You can see here the evolution in the first row of this panel, the evolution of the mirror trajectory over the time of the assessment procedure. In the second row, you see the corresponding pupil trajectory, and in the third row, you see the evolution of the objective score that we are giving. So you see that the objective score quickly stabilizes to a high value because we ask the patient, we ask the subject to actually do follow the mirror. So, here are a few results with control subjects, healthy one. We separated the set in three groups: one for one who was asked to track the mirror, and others who were asked not to track them. And we see that there is a strong and quick distinction between pursuit and no pursuit. We also tested quite quickly our system. We also tested our system on a few patients, And we see that for UWS patient, we have a very low score of 0.3 and 0.03 and 0.07, which is expected because they are not able to flow the mirror. And for MCS patients, we have a much higher score. So it suggests that our system can be used in practice in a hospital environment. So our next step will be to test our system on a larger set of MCS patients. Thank you.